Hi everyone. Just wanted to give you an update that I decided not to do chemo right now. And I know there's one or two of you out there that are going to be very disappointed to hear that. But my mom especially, has really done a lot of research on the chemotherapy drugs and their benefits. And I talked with Dr. Bartnick the other day as well. And the bottom line for me is I'm just not convinced that's going to work, that offers a true benefit. Honestly, there's too much conflicting information. For example, one of the studies that came out recently about a drug they want to use on me called adriamycin says that it's not good to use on people that are HER2 negative, which is me, and not to use it on them. So there are some studies and some other studies, and that's what they report. And yet, when I talk to Dr. Bartnick and these doctors at the University of Michigan, that's the drug that they want to use on me. And so when I ask them, well, what about the study? And they just kind of say, well, we go back and forth between whether it's a good or bad, or it's going to work or not work, but this is what we've been using for years, and this is what we use. And so, there's conflictions there. And then also, um, my family physician just went to a breast cancer symposium, and he offered us some information from there. And what it said regarding triple negative, which is me, is that some people do well with therapy, and some people do well without therapy, and that we don't really know for sure much about it. So to me, it's just a crapshoot. It's like that's what they know. These doctors, that's what they know. They know chemotherapy, but I just feel like there's other options. I don't think that chemotherapy is the only option. Um, and so I'm going to take a breather. I'm going to think for a few minutes before I even consider chemotherapy. I'd like to see more studies. I want to read the studies that show that for people that are triple negative, that the chemotherapy is going to provide a benefit, and I haven't seen that yet. So I'm going to be keeping my eye out for that, and then I'm going to be looking at cancer and diet and lifestyle, environment, perhaps detoxification. I don't know a lot about that. There's some concerns there, but something to learn about anyways. And I think that's all I can go on right now. I really do. It just doesn't, I'm not comfortable with doing chemotherapy that may or may not work, that they don't know for sure if it's good or bad, and then putting my body in a position to deplete all its immunity and I mean, that just doesn't seem right to get sick to get better. That concept doesn't really ring uh, with me, as far as, just doesn't seem to make sense anyways. And then, they talk about after chemotherapy, you're going to want to consider getting a mastectomy on the other side and getting a hysterectomy. And I'm just like, you know what? That is so much trauma to my body. How can that be helpful? How can that be helpful mentally and physically? I just feel like there's got to be another way for me to train my body to overcome these cancer cells in its own natural way. And so that's the route that I'm going to go right now, because the test showed there's no cancer that they can see. Of course, like I said, that doesn't mean that there's not any there, but if I can train my body to increase its immunity and overcome these cancer cells, I think that's the best thing that I can do, especially since I have such a higher risk for other cancers because of that BRCA gene. Um, so that's what I'm going to do right now. And I would just appreciate your support and prayers. I prayed so hard on this, and I've thought so much about this. It's not an easy decision. It's very difficult to walk away from what these doctors are telling me. It's very hard. But, they don't present the information. I'm just going to be honest. They don't present the information well. They kind of try to scare you, which I don't think is healthy for anybody that's going through this, to sit there and try to make you feel like if you don't do this, you're going to die. and they don't say that, but that's how they make you feel. And they don't present any other information at all. This is like chemotherapy, that's it. And the only way I would even get information about the effects of diet and what you need to do to change the environment that this cancer started in the first place is to seek that information out myself. And the fact they don't present the whole clear picture really just turns me off from it. I mean, how, if I were a doctor, I would say, hey, this is chemotherapy. These are the studies. Here's the studies. You can read them yourself. For your type of cancer, this is what we found, and this is why we want to use these drugs. So check it out, read it. If you have questions, let me know. I believe, if I was a doctor and I believed in chemotherapy, this is the best way, and these are the reasons exactly why. Other people have been studying diet, nutrition, and so here's some information about that. Cancer started growing in your body at some point. You need to change that environment so, it doesn't continue to grow there. You can't just go back to your regular life. You got to make a change. Here's the information about cancer nutrition. It's not scientifically proven. We're working a lot of stuff, but here's the benefits and the risks and the truth about it. Mental. Here's the information about mental health and how to stay positive and how to manage your stress, because some studies are showing that doing that can help prevent cancer recurrence. So here's the information about that. So, if they would present the whole entire picture, maybe I would feel more confident in what they're telling me. But when they just sit there and say, well, you need to do chemotherapy because that's proven results. Well, okay, that's great, but, show me the proven results. And I've done my research on my own, and I know that there's other things that can affect cancer recurrence. And so why are you not telling me about these? As you can tell, I get very frustrated about it. I'm very passionate about it. But so anyways, when I get more information and somebody can prove to me that this chemotherapy is a benefit for triple negative cancer, no preventive medicine that to make myself so sick is going to make me better, and prove it. Show me. You guys don't want me to look at anti-cancer stuff, nutrition. You don't talk about that because there's not scientific proof there. Well, I have not seen the scientific proof that what you're telling me is true. So that's kind of where I am at with everything. I'm scared. I'm really scared. I am. But I have to do what's right for me and what I feel in my heart. So, okay. I am off to work. We'll see you later.